We've all seen the Instagram post with a dozen red circles on someone's back or 10 cups applied throughout the entire body. And is that the best use of this cupping modality? And in this episode, we discussed that. And the answer is no. Just like with any other manual therapy technique, we need to be systematic by identifying the movement faults that we have decided are important to the person's outcome, and then find the underlying impairment and have a reliable measure of that underlying impairment. Once we do that, find a deficit, then we apply whatever modality it is, in this case, cupping, and determine with cupping with the addition of movement, does it improve the impairment measure? And if it does, we have an idea that we're more likely on the right track of using this modality in the right way. Find out more in the latest episode of the Rehab and Performance Lab.